Senator Elizabeth Warren was asked whether her Medicare for All plan would mean higher taxes for the middle class, and she has declined multiple times to say the plan would require higher taxes. When asked about that on Stephen Colbert's show, she responded by saying, "So, here's how we're going to do this. Costs are going to go up for the wealthiest Americans. For big corporations and hard-working middle-class families are going to see their costs going down. Healthcare is a basic human right. We fight for basic human rights, and that's Medicare for all. Everyone gets covered," she said. She also said that a big reason why families go broke is because of healthcare. Still, she avoided saying that Medicare for all would likely require a tax hike on the middle class. When Elizabeth Warren was asked during the third Democratic debate of September 12, 2019 if she could clearly state that higher taxes for the middle class would be required to fund Medicare for all, Warren said she would tax those at the very top, the richest individuals, the richest corporations. They are going to pay more. Middle-class families are going to pay less. Warren also said that the total cost would go down for hardworking families. Meanwhile, Bernie Sanders did not propose a single way he would cover the costs of his health care plan with. Instead, his office released a paper that included this list of possible options. 1. Creating a 4% income-based premium paid by employees, exempting the first $29,000 in income for a family of 4. 2. Imposing a 7.5% income-based premium paid by employers, exempting the first $2 million in payroll. 3. Eliminating health tax expenditures. 4. Making the federal income tax more progressive, including a marginal tax rate of up to 70% on those making above $10 million. 5. Making the estate tax more progressive, including a 77% top rate on an inheritance above $1 billion. 6. Establishing a tax on extreme wealth. 7. Closing a tax loophole that allows self-employed people to avoid paying certain taxes by creating an S-corporation. 8. Imposing a fee on large financial institution. 9. Repealing corporate accounting gimmicks. Still, it has not been clarified by him which items on this list would become law. Sanders' health care plan would move every American into one national insurance plan and would cover most medical services at zero cost when people go to the doctor or hospital. Elizabeth Warren and Kamala Harris, Cory Booker, and Kirsten Gillibrand signed on to his Medicare for All Act. The Sanders plan is the most maximalist overhaul in the field, a nationalizing of the health insurance industry. The Medicare for America bill would maintain the employer-based system that covers half of Americans right now. It would also, however, allow almost any American to move to a government plan if they wanted to. Beto O'Rourke and Pete Buttigieg have shown support for that idea. They like to say they support Medicare for all who want it, a halfway point between single-payer and more limited public options. On the other hand, Joe Biden has said he supports allowing every single American having access to a public insurance plan, but his campaign has not yet released the details on his proposal. He called the Affordable Care Act a big fucking deal right after President Barack Obama signed it. The more limited public options and buy-ins, like legislation sponsored by Amy Klobuchar and Michael Bennet, would allow the 10 million people who buy private insurance on the Obamacare marketplaces to join a public plan if they pay a premium. People on company-funded plans would not be able to buy the public plan, limiting the size and impact of the program.